In this video we will be talk about hiccups, its causes and treatment, so let's start. Hiccup is spasmodic involuntary contractions of diaphragm and intercoastal muscles that results in sudden inspiration and ends with abrupt closure of glottis. Now what are the causes of hiccups? So gastric distension because of overeating, carbonated beverages, aerophagia, which means swallowing air while chewing gum or smoking. Other causes include malignancy, multiple sclerosis, dexamethasone use, and lateral medullary syndrome of CNS also results in hiccups. Foreign body and ear, pharyngitis, laryngitis or other causes of hiccups. Hiccups lasting for less than 48 hours requires no treatment with drugs, and it will be managed with breath holding for 5 to 10 seconds or gargling with cold water or biting into lemon or swallowing teaspoon of dry sugar. Now what are persistent and intractable hiccups? So persistent hiccups are those when it lasts for 48 hours to 1 month, while intractable hiccups are those which lasts for more than 1 month. Now coming towards that, which drugs are used to treat hiccups? So proton pump inhibitors like omeprazole are used. First-line drugs used are baclofen 5 to 10 mg orally 3 times a day, and gabapentin 100 to 400 mg 3 times a day is used. If first-line drugs did not work, then metoclopramide 10 mg 3 to 4 times is used. Similarly, chlorpromazine 25 mg 3 times a day may be used. Other drugs include lidocaine, pregabalin, phenytoin, carbamazepine. So this was all about today's topic. For more informative videos, please subscribe to our channel and press the bell button. Thank you.